Hello, everyone, and welcome to the ASCP Social Media Committee's Path to Atlanta session, The Lab, Invading the Culture. I'm Professor Tiffany Gill. I'm so excited to be here. I'm also a committee member of the Social Media Committee, and so is my co-presenter, Dr. Patel. He will be in the later part of this presentation as we recorded these separately, so you'll get to meet him soon. What I have behind me is the Cell Bowl Stadium. So not only am I an MLT program director, I am also the YouTuber Medical Lab Lady Gill, and partnering up every year from October to November. I have an event called the Cell Bowl. It's a NFL style hematology competition using the Cellavision Cell Atlas app, and ASCP is my gold sponsor. So what I want to cover today with you is to learn how to bring your visions of ways to creatively spread awareness of the medical laboratory profession and pathology to the entire community, but also to connect our educational programs with say public schools, medical corporations, doctors' offices, in a fun, engaging way. So we're going to teach you how to do that today, and I can't wait to show you. So one of the things that I would say is to remember this image. You'll see some other images as we go through the presentation, but remember this image and try to think about what would be the prompt that I would have put in to the AI generating software to receive or get this image. That's what we're going to talk about today. So we're going to start off this session the right way. Here's our title slide. Again, I'm Tiffany Gill, and Dr. Patel will be recording shortly. We have no financial relationships with ineligible companies to disclose at this time. And the outcomes are seen here, but we basically want to increase community awareness of the field of pathology and laboratory medicine through engaging social media content. So how can you do that? With us, you can utilize free AI generating software to create promotional materials that strengthen career connections between community members, public education, colleges and universities, and medical corporations. So when you are thinking about any type of social media content, including using AI to generate some really creative items such as visuals and videos, what you want to think about is, why are you doing this? What's the purpose? What's the message you want to send to the audience? Who is your audience? Where is this going to be shared? How is it going to be used to create, to meet the need that you're trying to meet and to be successful at? And when is the right time to share it? When is the right time to use it? So those are the kinds of things that we want to think about as we're going through. So as I go through this presentation, I'm coming at this topic as a YouTuber, but also a MLT program director. So please make sure that you're aware. I'm just honing in on the medical laboratory technology and medical laboratory science positions and programs. So we are all aware that there is a workforce shortage. The U.S. Bureau of Labor Statistics estimates a little over 300,000 MLT and MLS positions within the year of 2020. There was flux within that year because of the pandemic, but we have the highest employment ranges in the largest metropolitan areas around the nation, and the mean wage is between 50 to 70,000, depending on where you live. And here are the top 10 metropolitan areas within the United States. I live in the Washington, D.C. metropolitan area, and our employment rate, as reported by that website, is 6,000, just over 6,000 people. Okay, I want you to remember that number because that's going to be important later. So the ASCP puts out a vacancy survey every year. We've all seen it. And the latest one from 2024 has provided some really great key points. One of them is that the vacancy rates have improved since 2022. However, we are still yet very closely, but still yet to meet those pre-COVID levels. And one of the things that the participants of the survey indicated was a lack of education and training programs as being one of the most common concerns that they had in finding people to fill these positions. And their really strong feelings were about not having enough credentialed personnel to meet that demand. So this is a graphic from that vacancy survey in 2024, and you can see that 2024 is in the orange, and we're starting to do a really great job getting past those 2022 levels, which is in the blue. And we still have obvious areas to grow in, and Dr. Patel can talk about the anatomic pathology and histology folks over in the AP side of the lab, but that's not that's not my purview right now. So please feel free to continue to see how he presents that information. So we've got NACLS accredited programs all over the nation that are preparing individuals with quality education to get those ASCP credentials. And every year, NACLS also does an annual survey to see the trends in how viable programs are and what our needs are. And the 2023 annual survey showed a deficit of graduates to replace the increasing vacancies. So there were roughly 6,000, almost 7,000 graduates nationally from all NACLS accredited MLT and MLS programs in 2023. Now, do you remember that statistic that I showed you earlier about the area that I live, the metropolitan area? This just covers that area. And just so. So we can see that we absolutely need to make sure that we're teaching the public in an engaging way about our educational programs, because if we don't get people into our educational programs, then obviously the workforce will not be improved. That those vacancies will not go away. So looking at the statistics that they have, we see an average number of roughly 9 to 10 vacancies within MLS and MLT programs, and some of them have really large vacancies in their cohorts. But the annual survey discussed a lack of community awareness of the field as being one of the major reasons why we're seeing these vacancies. So on the left, we have the numbers of programs within the United States that are NACLS accredited by program type. And on the right, we have the number of graduates per year. So the max or the highest number of graduates and highest number of programs are the MLS and MLT programs. And we're staying kind of steady with that. We are increasing in graduates of MLS programs, but not in MLT programs. So there's really an area of growth, opportunity for growth there. And how can we really do that? Well, what we can do is really interact with the public. That includes students that are already in our programs, their families, public school students, the public school system, so the teachers there, because if the teachers don't know about it, they're not going to talk to the students about the career. And we really need to make the profession um, understandable and relatable, because people know what they see, and they feel comfortable with things they see. So, what we can do is we can engage with the community through lab themed educational events that can happen annually or however frequently we want them to. But two opportunities that I already see here are Lab Week and Cell Bowl. So obviously, I'm leaning into Cell Bowl today, but one of the ideas here is to connect um, public schools all the way through healthcare corporations in a way that the public already identifies with. So Cell Bowl happens during the NFL season, and oh my goodness, it's an NFL themed event. So we're trying to meet people where they are and then bring them to where we want them to be in knowledge, in engagement, all of that. So I used Meta AI from Facebook to create this image. And what I did was I typed in a prompt, and what I said said something to the effect of, uh, imagine, because you always have to start with imagine medical laboratory science students playing American football, because if you type in football, it comes up with soccer. So playing American football in a stadium with white coats, medical gloves, and goggles on. And this is what I got. My account actually knows me so well now that I don't have to do too much prompting anymore, that I'm tending to get exactly what I want, including lighting, time of day, um, the atmosphere. So some of them I don't even have the red cells floating around in the air. But then I'm like, wait a minute, I want to make sure that we understand this is a hematology competition. So let's add those red cells floating around in the air. So that is one great way that now I can market the Cell Bowl. And how can I make it even more visually engaging and create something where you're really, it, in this world, this imaginary world, because I don't have a multi-million dollar stadium, and these students are not traveling from all over the US to come into the stadium, but I'm creating this world where they are. And there's so much more hype now that people can see what exactly I was going for, creatively speaking. And now that they understand it by this visual, they can see what the game is about. Okay. From the cells, you can see it's something to do with hematology. And from them playing football, okay, it's some type of competition that's kind of related to football, or looks or is held similarly to football. And just seeing if we can continue to make that more um, understandable by using these type of visuals. So you're going to see a commercial that I made using InVideo AI, and that's a free online platform where you can make or generate free videos, and we'll go ahead and watch it.
So I just won a competition by staring at blood cells all day, and honestly, it was incredible. It's called the Cell Bowl, this hematology competition where you identify 30 blood cells in 1 minute. I thought medical lab stuff would be super boring, but they literally gamified it. Educational, but make it competitive. I learned more in one competition than months of textbooks. If you're in healthcare or just curious about what happens in medical labs, you need to try this.
So the funny thing about that commercial is that was not the script that I put in there, but it really targeted the mindset and language of people of college age. And I decided, oh wow, I really like that. And then I started to mess with the graphics using the Meta AI
So I
graphics.
just want to
that I had from Facebook.
So I just won a competition by
I'm so sorry that that keeps playing. But all of that is AI generated. Those people are not real. None of none of that is real. It was created online using InVideo and the free version. I'm sure if I had gotten the premium version, you'd be able to see the pictures better. My logo at the end was completely cut off, and so I tried to fix it, but it wouldn't. So what you can do is you, in your own creative way, can add to the campaign of awareness for the educational programs, but the profession also, um, to help everyone understand what it is that the lab does. So I just explained to you how I used both Meta AI in Facebook and in video, but the whole goal that I was trying to achieve was to inform the public about what the cell bowl really is. And a picture is worth 1,000 words. We didn't have 1,000 words, but it was less than 30 seconds. It was straight to the point. The visuals used were to give that NFL style feel and to show that there are blood cells that are being identified and it's a competition. And the AI generated person is of the age of a college student and she's talking to the audience as if they were college students too, and she's using that type of vernacular. So the key idea here is we can create commercials, we can create images, we can create events that are shareable and able to be used on, say, smart televisions in doctors' offices, waiting rooms. I mean, if the public really loves football, then we could get them to love the lab through a football style competition, right? We could absolutely partner with different doctors' offices or hospitals, ER waiting rooms, and ask them to play the Cell Bowl or whatever kind of event that we're going to do, Lab Week event stuff. Just something to reach the public in an unexpected way, but creatively engage them. Uh, and they'll be so shocked that they'll probably be talking about it somewhere else and like, hey, did you all see this? Do you know what that is? And then immediately look it up. They might even look it up before they even talk to anybody about it. So again, the AI generator I used for the images was Meta AI in Facebook and in video AI online for the video part, but you did see the Meta AI photos within that commercial. So the first thing you want to do is obviously identify who, what, where, when, why, how, right? All of those things to make sure that you're creating content that meets a desired goal. But it really hinges on the narrative. You want to make something very concise and to the point, and you want to make it less than 30 seconds. So if you have this really creative mind and you want to bring something to life, you can absolutely use a picture generator to help you make that video, just like I did. You want to select images that show excitement for whatever it is that you want to show excitement for, them doing whatever it is that you're trying to convey, and that really, in all sense of it, that the script and the images together are meeting in an impactful way, that you get the goal that you want to achieve. So, how do you create the AI images using Meta AI? Well, you go to make a post in Facebook, and then at the bottom, it asks you what you would like to include in your post. Go down to AI images, and it'll give you some different ideas of things that you could make. But you always have to start with the word imagine, So you would type in imagine, and then just like I told you, imagine medical laboratory science students playing American football in a stadium in white lab coats, medical gloves, and goggles with red blood cells floating in the air. And that's exactly how I got started. Uh, that's not necessarily going to be what you're going to do, but sky's the limit here. You can save the images if you like what immediately gets made. You can edit that image, but if you go to edit that image, you're not getting all those other options back. So before you go to edit anything, save all the ones that you liked. You can share the images. You can also even animate those images in Meta AI. So feel free to play around and work with. You can work with the social media committee. You can just share it with friends. You can put this anywhere, but reach out to a local institution, whether it's the institution you work at in the hospital, or if it's at your facility as an educator, whatever. You can reach out to those stakeholders and um, give them some engaging content to do your own campaign if you'd like, to improve awareness about the field of pathology and laboratory medicine. All right, so next up is my wonderful co-presenter. Thank you so much for your time, and we look forward to seeing all the engaging social media content that you have created. All right.
Okay, welcome everybody. This time we're going to talk about pathology career exposure, and we're going to take a look at it from a pathologist perspective. So my name is Vihar Patel. I'm a neuropathologist and assistant professor at UC Davis Department of Pathology. I'm also the pathology residency program director, and I have a number of roles at the UC Davis Medical School, which include a discipline lead for histology curriculum, the discipline lead for biochemistry, for neuroanatomy. I'm also the pathology specialty advisor, and I serve on the ASCP Pathologist Council, and I was a former member of the Residents Council. So this is just some background about me. On the right here, I have this emblem. This is of my nonprofit. It's called Sabre Foundation, Skaters Advancing Brain Education Research, and some of the work that I'm going to be talking about in this presentation and some of the work that I've done which I will show you in this presentation, has been in collaboration with this foundation. So we're going to take a look at the pathology workforce at a glance and talk about why we want to expose the general community to pathology, to students to pathology, and patients to pathology. We pathologists know that we are physicians who specialize in diagnosing diseases by examining tissues, cells, blood, and other body fluids, but not many people outside of our world really know what it is that we do, even if it's from the AP perspective or from the CP perspective. We devote our careers to providing answers to diagnostic questions, dilemmas, and we give patients, families, and the clinical colleagues the information that they need to guide treatment. We are all well aware of this, but the general population, not so much. And this may stem from a few misconceptions that have been building up for quite some time. So, for example, a misconception is that pathologists don't interact with patients. This is not technically true, right? Well, first of all, as a pathologist, a practicing clinical as a practicing pathologist, you're board certified by your state. There's no law that says that you can't speak to a patient or anything like that because you're a pathologist. It's just the nature of our work doesn't align so well with seeing the patient at the front as opposed to seeing their tissues as a form of a specimen on our microscope stage. But in reality, there's many pathologists. One of my colleagues here in this department who actually perform fine needle aspiration. So she actually goes, sees the patient, talks to them, performs the procedure, makes the diagnosis on the spot. Also, you're probably aware of apheresis, transfusion medicine. That's the one specialty in pathology where you're directly involved in patient care. You have to consult patients, set up the apheresis service. You have to follow the patients as if they're inpatient throughout their stay, right? And oftentimes we can actually directly speak with patients when it comes to their pathology results. And I will talk a little bit more on that later. Another misconception, pathologists only work with dead bodies. I mean, even for myself, when I was an undergrad, I had no idea what a pathologist was except for forensic medicine. And I was like, okay, that's cool, but I don't see myself doing that because I thought I was going to be a neurologist. So I had no idea that there was a whole other field of pathology, subfields in anatomic pathology and even clinical pathology, right? So I was just ignorant and I didn't know any better. So I fell into this misconception. Pathology is boring, just looking at slides. This one irritates me a lot because it's like, what do you mean by looking at slides, right? You just look at a slide, that's like, what is on the slide? That's the most interesting thing, right? You're looking at cells, tissues, tumors, medical diseases. You're not just looking at a slide, whatever that means. So that one really irritates me. Then pathologists aren't involved in clinical medicine. This is pretty infuriating because we as pathologists who do our work, whether we're AP or CP, we know from the work that we do that we're integrated into medicine from the moment the patient steps into the clinical hospital. It's funny because in my experience and what I've seen, it's like nobody knows that they're interacting with pathology as soon as they step into the hospital. The moment that someone takes your blood from a phlebotomist or a nurse, whoever is doing that, and they take it to the clinical laboratory for all these tests that the clinicians have ordered, that's all clinical chemistry. That's CP basically, right? Hematology, microbiology, all of that stuff is under the realm of pathology, right? They're interacting with pathology without even knowing that they're interacting with pathology. And then when it comes to the anatomic side, tumors, biopsies, whatever, that is all pathology as well. So we're pretty well integrated into the medical system. Even transfusion medicine, they order the type and screen. There's a massive transfusion protocol. We on the pathology side are the ones who put all those blood products together, make sure everything matches, and then actually ship that out to the clinical team, right? We're the ones doing all that. So we are well integrated into the medical system. It's just nobody knows who we are because we're behind the scenes. Pathologists don't earn as much. That's a bunch of nonsense, right? We actually make more than some other specialties do. So there's a lot of misconceptions out there, and I think we have to do a good job of breaking these misconceptions down and really showing people what it is that we do and the realities of what we do. Right? And there's a number of factors that go. There are a number of factors that go into these misconceptions that have been perpetuated throughout the years. The lack of exposure the pathologists receive to the general public and patients is a significant reason. And that's by the nature of our work, right? We're not the first person that the patient sees. We don't do the HPI. We don't do the physical examination. We don't do any of that stuff. We're behind the scenes. We get their tissue samples. We look at that, but we take all that information to account. And because there is that separation, nobody really knows what we're doing, right? When you send out a pathology report, it goes out in a bunch of words. And then the patient looks at that and they may see your name. That's the closest thing that they have to interacting with you as a pathologist is your name, outside of you actually reaching out to them or they reaching out to you and talking to you, right? So they don't generally see us, and it's up to us to make it known that, hey, we are part of the healthcare system. We're part of the clinical team that actually provides a diagnosis for you and cares for you. So in the pipeline, as of 2023, there's about 21,000 U.S. pathologists. There's about 21,000 U.S. physicians that are pathologists. That's about 2.1% of the physician population. An average of 621 resident positions, an average of 621 residency positions from 2021 to 2025. Actually pretty high, 99.5% fill rate in 2025. So this has been increasing over the years. There's about an almost 90% match rate for U.S. medical grads. This has also been increasing over the past few years. When I was a medical student, not many U.S. medical students were actually applying to pathology. It was seen as a non-competitive field, but things have changed. It's pretty competitive now because there's a high match rate. There's probably a number of reasons that go into that, which I'll go into in a bit. But suffice it to say that this is actually positive news. There's new pathologists entering the workforce, about 600 in the US each year, but we need 700 to 840 needed per year pretty soon, right? So we need to add to our workforce, to our pipeline that already exists. And by 2037, we're going to see about a 16% increase in the workload or demand, or we'll need about almost 3,000 more pathologists. Right? And part of the issue here is that over 30% of the pathologist population are 60 years or older, right? And almost another 30% are 65 years or older. So both of these groups of practicing pathologists are going to be retiring soon, or already in the phase of retirement. And so now we're going to need to find younger pathologists to fill those roles to continue to meet the demands of our specialty and the growing patient population, right? So we definitely need to, so our work is cut out for us in order to find these new, so our work is cut out for us in terms of getting new graduates into the pipeline for pathology. So the issues, some of the issues of some of the issues that deal with getting exposure to pathology stems at the levels of surprising institutions, the medical school, right? The curriculum has changed. For many of us, we experienced the traditional legacy curriculum where you had, your first 2 years were your basic sciences, and then years 3 and 4 were clinical rotations. Pathology was a standalone course in the legacy curriculum. It was a whole year where you learned about pathology. It was a second year course for me. Now it's woven into the systems-based practice. It is no longer a standalone course. Now it's like, oh, we're going to talk about, for example, right now in the med school, we're talking about molecular and cellular medicine. So it's biochemistry, it's introduction to pharmacology, and those things for the first year medical students. And there might be some disease and somewhat exposure to pathology kind of weaved into that. The second years get a little bit more, but it's all based on systems, right? If they're studying the endocrine system, they're going to learn about the endocrine pathology in that system, but it's not a standalone course where you actually have to go through and learn everything that's pathology related and get like a robust education in that. Now it's kind of broken up into segments. It's kind of cluttered in with everything else the medical students are learning. So it's kind of, if you're not actually involved in the teaching of these, you really have no idea what it is that the students are taking away from what they need to take away from pathology. The vast majority of medical students, and therefore when they graduate practicing physicians, never rotate through pathology during clerkship or clinical rotations. Right? Only a small fraction of students ever come through pathology. Obviously, the ones who are interested in it are going to go do it, but the ones who are not interested in it, only a small percentage of them actually come through and rotate through pathology. The vast majority of them have never even seen what we do behind the lens. They just see pathology as a bunch of images that they have to memorize as a board exam question. So in reality, they have no idea what it is that we do, how we're integrated into the healthcare system, or the basics of specimen processing, right? And this goes to the heart of the question of exposure, to educating everybody about what it is that we do and how we relate to medicine. And this is a good example of commonly what could happen, right? There's a clinician, they send a tissue specimen in formalin, they send it to the pathology department, this black box. Nobody has any idea what happens in this black box. This black box then spits out a report, the pathology report. The clinician takes that pathology report and discusses it with the patient, right? And then Here they discuss diagnosis, management, and treatment. All that was done by the black box, but nobody really has, outside of the clinician themselves, the patient or anybody else has no idea what it is that we're doing. Right? So we're just seen as this nebulous entity. We're just seen as this nebulous entity. Another interesting aspect, if you take a look at it from this perspective, is the media, right? There's news, TV shows, documentaries, etc. They often focus on forensic pathology. This is because of celebrity cases in the media, cool science lab, forensic tech kind of vibe, murder mysteries, etc. Things that captivates people's interest or it's mysterious to people. But there's a host of subspecialties within anatomic and clinical pathology that aren't ever discussed. Many of them are directly related to the most common medical conditions and cancers. I've never seen a show about a surgical pathologist or a transfusion medicine pathologist or anything like that. It's always, if it's from the path perspective, most often it's through forensics, even documentaries or whatever it is. There's always some connection to that. So I have no issues with that, but maybe they should look into everything else that we do. And many patients, their family members, and even healthcare workers have no idea who we are, what we do, or how we impact their care. But it's not their fault, right? We need to do a better job at showing them how we are involved, who we are, and how we play a role. This is a good example. ASCP actually has a program called Patient Champions, and these are stories from patients who have been impacted by the lab and have some connection to pathology and they have an entire program that's dedicated to the patients raising awareness about their conditions and how pathology impacted their diagnosis or their treatment. And they have educational resources, they have brochures, videos. If you are a patient, you can also participate in this. So this is one way the ASCP is doing what they can with the resources that they have to let the media, to let everybody know how we interact with patients or how we are involved in patient care. Another example, relatively new, is called pathology consultation clinics. So this is where the patient can actually meet with a pathologist after the diagnosis has been rendered and the case has been signed out. They can schedule an appointment, a consultation appointment, where the patient can come in, they can sit down with the pathologist, they can look at their slides, the pathologist will show them their slides, they can explain to them what they're seeing, they can explain to them the diagnosis. And this is a brand, you think of it as a brand new way, but it's really what should have been done in the beginning because we as diagnosticians are the ones who best know the disease in the terms of diagnostic perspective. So we should be the ones telling the patients what the diagnosis is, what that really means. And then when they go to the clinicians for management and treatment, they'll have a pretty good understanding of what that disease process already is, and that will make understanding the treatment options much more easier and faster. And it's directly from the pathologist. So there's a number of ways that you can get involved to raise awareness about pathology to the general community, right? There's a number of target audiences and a number of content that you can use. So you can talk about the community at large, students, patients, right? We kind of covered patients from an organization perspective, content, social media, presentations, live activities, right? In terms of content creation, you can use your own images to generate pathology content, right? If you have an interesting case or an interesting tumor or some rare entity, you can take images of that, you can make content out of that, you can talk about that. Obviously, you're not going to give out patient information, but you can talk about the process. You can talk about, a specific cell type or something like that. You can make tons of educational content out there. And there's a lot of students are using social media, whether you want to accept that or not, as a means of getting content, right? They're looking at stuff on Instagram, they're using YouTube videos, they're doing they're using a lot of these resources to get more information and sometimes even use them to learn. So you can be a means to expose them to pathology through learning, right? If medical students are learning for a specific disease, you can create a specific area of content based on your expertise about the pathology of a particular disease, for example. And students will find that if you put that out on the internet. You can use AI to generate images or videos about pathology content. Right here, the key is the prompt. The more detailed and nuanced your prompt is, the better the image or video will be. Right here is an example for a prompt for a commercial for pathology. Right, so I literally took this prompt and I put it into the same in-video AI generator that was previously talked about. I want to create a commercial like those seen for pharmaceutical products, but the top is exposure to pathology. I want to use B-roll content, and I want them to talk about, and I want them to show pathologists looking at slides in the microscope, interacting with colleagues, perhaps patients, and an overall message of exposure to pathology. All right, simple prompt, well, somewhat simple prompt. And this is the video that came, so let's see if this works.
Doctors save lives on the front lines, but behind the scenes, another crucial job is happening. Pathologists don't treat symptoms, they name the enemy, looking at tiny patterns in tissue that decide surgery, chemo, hope. What looks like chaos under the lens is a roadmap. They huddle with surgeons, oncologists, and families, turning slides into clear next steps. They are the interpreters of the body's secrets. Curious? Come see the field that names the problem, so treatment can do its work.
Right, and so this is completely free. This is the free version. Obviously, you can see watermarks. They're using stock images and stock video resources, but it does the work for you. I mean, you can pay for a better, you can remove the watermarks, you can have AI generate its own images or videos and stuff like that. But I mean, going from a simple prompt to generating this for free, that's not bad, right? So at least that gives you a conceptual idea of what you can do if you don't have time to make your own content. There are resources out there that you can utilize to make content for you.
Doctors save lives.
So now we're going to talk about students, and we're talking about presentations and live activities. So the key thing here is reaching out, right? Leverage your hometown connections. I do a lot of work with the high school students. I live in Davis, which is Northern California. My high school is about 3 hours away in the Central Valley. And when I get a chance, I go out there and I give presentations. So every year there's a career day. So I make sure I show up for a career day where I can talk about what my career is, how to get involved into it, or pathology related occupations such as pathology assisted or histotech and things like that. Reaching out to your high schools in your hometown or where you currently live is actually not that difficult to do, and the teachers will be thrilled to give you an opportunity to present what you do to their students. It's very easy to make these connections happen. You just have to reach out because they have no idea who you are. They don't know that they can reach out to you. And when someone of your stature who's a practicing physician reaches out to them and say, hey, I want to talk to these kids about what it is that I do, their minds are gonna be blown. They're gonna be like, what, you really want to do this? And it's relatively easy to do. For example, here, I was at my high school earlier this year, and I always make content out of it, and I talk to them. I have a PowerPoint presentation. On this day, there's like 4 classes that come through per day, so I give the same presentation to 4 different sets of students. These kids are all interested in pursuing some healthcare field, right? So this gives me an opportunity to expose them to pathology, what it is, way before they even think about the seed even gets, germinated in their mind. I get to actually plant it way back in high school. I had no idea what pathology was in high school, not even on my radar. And when I was in college, it was like forensic medicine. So this gives me an opportunity to raise awareness about what it is that we do to these kids who may not start thinking about it and be like, hey, maybe this is something I want to do. Maybe this is something I want to pursue. right? Live activities. We've actually had students come up to the UC Davis Medical Center, and we have a host of activities for them. We have stations where they can get the inside of their mouth swab, their buccal mucosa, and we can look at their cells on a cytology preparation. We have, normal histology slides on a microscope that they can look at. We've got plasticated organs that have disease processes that I can show them. We've had medical students involved. We've had residents involved. I've had my colleagues involved. We can serve as a panel for these students to talk to. There's a number of different things that you can do to increase awareness and exposure to the student population. All it takes is a bit of effort from your side in setting things up and getting people involved. But once you get that process going, people are going to want to participate. It's actually pretty fun for something like this. We even have them come through and we give them tours of the medical center here and the pathology department. And I also take them to the undergrad campus at UC Davis so they can get an idea of what life is like as an undergrad student. And so this is all through the lens of pathology, right? So it's another activity that you can do. And these are actually the most fruitful types of events because you get to engage in them one-on-one and they get to ask you questions. You get to talk to them about what it is that they want to do. And it's a very fruitful experience for everybody involved. Right, here are some examples from the last session that we had here. They're making their own cytology. They're staining their own cytology preps. These are some of their squamous cells from their buccal mucosa that you could see here. Here they're actually inking some specimens that were made by one of our residents, and so they're practicing what grossing is like when they're a resident. So a number of activities you can do. You can create almost anything that you want to do, and the students will love to participate, and you get to teach them about pathology. And so reaching out is the key thing, right? For medical students, if you want to get involved, if you want medical students to get involved, look at and see if your institution has a pathology student interest group. This is one of the easiest ways to get involved. If they already have a pathology student interest group, then you can get them involved in what you're doing, or you can even ask them, hey, what do you guys have planned, or how do you want to work at exposing pathology to your medical student population, but also other parties, maybe high school students, maybe the general community, right? And if there is not a pathology student interest group, maybe you have some students that have reached out to you who are interested in pathology. You might want to plant the seed in their head and be like, do you guys want to start a pathology student interest group if one doesn't already exist? If you're doing activities at a local high school or undergraduate campus, you can reach out to the medical students to help out, to participate. I actually did that last weekend. We had an event that happened at the main campus at UC Davis, and I had a couple medical students from our first year medical student class come out and participate. Get involved in the medical education curriculum so they can see and interact with you, right? All types of physicians are involved in the curriculum. They see all types of clinicians. So you as a pathologist can get involved and they can see you. They can interact with you. They can get an idea of like, oh, this person actually exists and is talking to me, right? You're breaking that misconception of like pathologists or like they don't like to talk to people or whatever it is. Like you're front and center. You're talking to them. You're explaining to them disease processes, and you're the one that has all the answers. And so they're always like how did you get to where you are, right? And so there's a whole nother realm of exposure that you can get just from the medical education curriculum alone. And the fact that you are a pathologist out there front and center will actually, a lot of students will start to look at it and be like, what is it that you do? What does your day look like? Can I shadow you? I take students, just the other day I was in office hours and I got paged and I took like 5 students with me to the frozen section room, right? These opportunities otherwise don't exist. So get involved in the medical education curriculum. It's a great chance to see the medical students and expose them to pathology at an early stage before they even think about it by the time it's too late when they're already third years or possibly fourth years and finding out that they want to do this now. And if your institution has pathology rotations for medical students, it's super easy to get involved with that, right? So the takeaways for this is use tools that are already available to spread awareness about pathology as a career, right? Leverage generative AI if you don't have time or skills to make the content. Students, especially undergrads and younger students, will welcome an opportunity to engage with you, especially those that are driven towards a science or medical career. If you're going to reach out to the high schools, make sure you tell the high schools, I'm looking to target students who are interested in pursuing a healthcare or science career, right? may not be the best use of your time if you're just talking to a general population of students and you have no idea what their interest levels are. So the more focused you can be, the more fruitful your endeavors will be. And remember, you are the expert in your field. So use that as leverage when reaching out, right? You're a practicing physician. You're an MD, you're a DO, you're a practicing pathologist. That carries some weight. So when they see that, they're going to be like, oh, okay, this person is real. They've done the work, they're credentialed, like they're board certified. That adds a lot of weight to what it is that you bring to the table. So make sure you leverage that. I myself don't like to do that. I don't like to say like, hey, I'm a doctor, blah, 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 blah. But I mean, sometimes you got to use the tools in your toolkit. So use them to your advantage. And in general, hopefully you get an idea of, what it is that we're trying to do when we talk about exposure to pathology. Really we just want people to know about what it is that we do, how we're involved in patient care, and the career that we can expect to have as a pathologist. And the only way that we can actually do that is by taking the effort and the initiative, and in our own little worlds where we all live, just doing that. Even if we do that locally in our own little worlds of where we live, and many of us do that, I think you will still make an impact in the general community, in students and in patients, and what pathology is and how we integrate into medicine and why we enjoy it. So hopefully you enjoyed this presentation, and if you have any questions, you can always reach me. Feel free to reach out. You can send me an email. And I thank you for your time.